It's Marlissa here again. I am talking to Dr. Josh Feddes here at
Feddes Chiropractic.
Oh, well, hey.
Yes, hi.
How's
Thanks
it
for having
going?
me. It's going great.
Good. The sun is shining today.
Yes, nice.
It's a good thing
Yes.
because we don't see sun a lot of the times. So tell me a little bit about you, Dr. Josh.
Well, what do you want to know?
Well, sometimes you say certain words like processes, and they sound a little different than what they do whenever, we say that here in Illinois.
In Illinois.
So
well,
where's
for
this?
one, it took me a long time not to say Illinois because I was told that there is a silent S at the end of it. But why I sound funny? Believe it or not, I sound funny everywhere I go. I actually was born and raised in Canada, and people thought it was a Canadian accent, but I've been to Missouri and they think I have a Texas accent. So I blame it on having too big of a tongue when I was a kid because I went through like 4 years of speech therapy and I want my money back because it didn't help apparently. So, but that may answer some questions. I was born and raised in Canada and you know how us Canadians sound a little bit different.
Well, honestly, though, I really had no idea you're from Canada, except every once in a while you say certain words. But I just had to tease a little bit on that. So anyway, you live here in Olney now, and you live with, just tell me about your family, your wife, your kids.
So me and my wife met and fell in love in the photocopy room, believe it or not, in Logan College of Chiropractic in probably 2003-ish. It was one of those love at first sight deals.
Nice.
Strangely enough, she was actually Canadian as well. And there was probably a point in time where both of us went to the same university, University of Windsor in Canada. But I had to travel 800 miles just to meet her. So we met. She graduated. She's actually a chiropractor as well, Dr. McKinney. Which she finally is going to keep me, I guess. So she changed her name officially to Feddes about 3 years ago. She gave it to me as a Christmas present. I'm like, well, finally, I guess I passed the test. So she finally changed her name to Feddes, but we call her Dr. McKinney to avoid any distraction or just trouble. And I graduated in 2005, and she graduated in 2007. We moved to Michigan to try and be closer to our families. Turns out we didn't see our families much then. We actually see them way more now. We were both running practices for other doctors of chiropractic. I was running one by myself and another one. She was running one by herself. Good experience, great people. Michigan was great. After 10 years of doing that, we had just had our second child, and we were basically dropping that kid off at daycare at 7 in the morning, picking him up at 7 o'clock at night. It just wasn't the type of lifestyle either of us wanted. We wanted to, be able to have a family life, coach soccer, see kids games. So it wasn't working for us. So we found this place down here. A friend of mine in Florida actually said this place was for sale, and it was a good fit, and it worked out, and here we are. And we were both from small towns in Canada, so it's not a big change of scenery for us. We're not big city people. I was born and raised on a farm. I did every farm job you can imagine, and then she grew up in a town of about 7,000 people as well. So it wasn't a big deal for us, and we love it here.
So I'm born and raised on a farm. Like, isn't there like a side of like animal science where they have like chiropractor care for animals?
Yeah. So
have you ever tried that out?
I have treated canines. I've adjusted dogs and cats, my own cats, my own dogs, and some other dogs. Dogs with long spines, surprisingly enough, or not surprisingly enough, they usually have back problems. Those corgis, those little wiener dogs, those Dachshunds, whatever they're called, and it happens all the time. In fact, when I was in chiropractic college, we had a yellow lab, and we were out in the woods cutting down trees, and she must have did something to her back, and she was dragging her back end, and I happened to have a little adjustment tool called Activator. And when we got home, I used that on the dog, and she was able to then lift and go, and the pain went away. So, yeah, there's equine chiropractors, very common, especially Kentucky, Tennessee. I have a friend that went to Michigan, and they adjust horses, which if you think your neck cracks loud as a human, imagine cracking a horse vertebrae that's about yay big. They actually sometimes they do it by hand, but they also have like these specialized, almost like chiseled but rounded off wooden things, and they use a mallet and they go boom, and it's like a shotgun going off.
Wow.
big race horses, high dollar, $1 million race horses, they all have chiropractors. Probably have their own chiropractors. But I don't do that. There is a special training you can do after you're a licensed chiropractor that you can actually do animal adjustment.
Okay, so if people start showing up here shortly with to get an adjustment and they bring in their dog, you'll know why, right?
Yeah, don't do that. Don't do that. I do not adjust. Now, after hours, if I do it in my free time, maybe we can make that happen. But don't bring your dogs to me. There's actually some veterinarians, actually. I think they can also take an alternative secondary course to adjust pets, dogs especially, too. Because I know some people that have problems with vets that they do adjustments, and it's a wonderful thing when your dog's in pain and you just can't do anything for them. So it's a nice thing to be able to do.
Nice. Very good. So what... I guess we should just start out with okay, so what is a chiropractor? Like, what is that?
Good question. So, chiropractic in general is a unique, holistic, vitalistic approach to healthcare, a conservative approach to healthcare that really utilizes the body's natural abilities to heal. It's based on science, philosophy, and art. To give you a little bit of a history about chiropractic, it started by a guy named D.D. Palmer in 1895. He was working as a magnetic healer back in the day in Davenport, Iowa, to a university there. And he noticed the connection between the spine and different things that were going on. So one day, the janitor that was working at the school came to him, and he hit his head on a steam pipe, and he had a very misplaced upper part of his neck, the atlas, which is the ring-like bone that holds your skull in place. And it shifted so greatly that over the next couple of weeks, this gentleman started to lose his hearing. So he looked at him, looked at his anatomy. He noticed what natural anatomy looked like and what it didn't. And he noticed that this vertebrae was slightly shifted to the one side. So he laid him on a table and he pressed down, heard a pop, his vertebrae shifted, and over the course of the next few days, his hearing slowly returned. And he said, there must be something to this. So chiropractic historically has always involved the nervous system. And when you think of like a master organ of your health, the nervous system ultimately controls everything in your body. Even in your brain, there's a place called the hypothalamus where it connects with your pituitary gland, which is your master endocrine gland, and it correlates between the brain and all the synapses, maintains health, homeostasis, balance, allows your bodies to be healthy when given the things the body needs to be healthy. So that was off on a little tangent. I don't know if that answered your question, but what chiropractors ultimately do is we remove nerve interference in the body by finding and identifying subluxation complexes, which cause a whole cascade of neurological events and obviously pain. So the majority of the time, a lot of people think you have to go to a chiropractor just, if you're in pain, or we're back doctors, we're pain doctors, and it actually does a lot more than just that. But fundamentally, we treat and find and treat subluxations. Okay,
so that's like what I, am passionate about is everything preventative, like how preventative health. So you're saying, because a lot of people, what I hear is they'll hurt their back or whatever, and they'll be like, oh, maybe I should go to the chiropractor. But that's more of like, all right, that's more of a treatment. But how do you use chiropractic care as a preventative?
So, like you said, a lot of people, what brings them in the door is that they're going to be in pain. Pain has always been a good motivator to getting people in the door. But by the time you have pain, usually you'll have 30 to 40% nerve interference by the time you're even having pain. So to give you an example, like preventive health, how often do you go to the dentist?
Every 6 months.
So why? Why not just wait to go to the dentist until you have pain?
Right, because I'm preventing my cavities.
Right. So a dentist specializes in identifying dental cavities, if you will. They're going to be able to see cavities before you maybe are able to feel them. If you waited till you had pain due to a cavity, you probably waited too long. You're going to have damage that is beyond fixing, beyond repair. So you want to be preventative in that same sense. So chiropractors, just like dentists in that sense, we are able to detect vertebral subluxations before they become symptomatic. So some people will come into me and they'll say, oh, doc, my back's killing me. And maybe we find that vertebrae in their lower back is subluxated, their pelvis and their sacrum is twisted a little bit, and it by default is creating some sciatic pain down their leg, and now they're having numbness and tingling down their legs. I take x-rays, A lot of chiropractors take x-rays, some don't. The main reason we take x-rays is we really want to have a good baseline to where they're at. It allows us to determine if there's any red flags to care. For example, if you had instability in your spine, we're really good at finding joints that are stuck and not moving properly. But if you have a joint that moves too much, then what do? Maybe we don't want to adjust those joints, but we also identify things like congenital anomalies. People are born with certain things that we need to know about.
Yeah.
Even severe osteoporosis or severe degenerative arthritis or the other different types of arthrotides that are out there. DISH is an example, rheumatoid arthritis, psoriatic arthritis. So we're doing that to rule out anything that we need to look at. And ultimately, when they come in and they have that sciatic pain, we're treating that sciatic pain, and usually they get good results. They come because they feel better after they get adjusted. But then they say things like, you know what, doc, my back is feeling good. Thanks for that. But you know what else is weird? I usually have to take Tums and antacids all the time. And since I've been seeing you for the last 3 weeks, I haven't had to do that. Or my sinus and allergies are better. Or I'm sleeping better at night. Like, what's with that? And the reasoning is that when your nervous system isn't working properly, it's going to cause those type of processes eventually to a disease state. So the D.D. Palmer, who originally came up with chiropractic and the premises behind it, dealing with the nervous system, he knew that if there was nerve interference anywhere in the body, it's going to manifest as disease eventually. Now, some people that are fit, they're healthy, they eat all the right things, they minimize their chemical, physical, emotional stress, and they don't ever do stuff that we're not supposed to do, like lift heavy things, repetitive motion, sit all day long is actually very bad. They even say smoking is the new sitting.
Right.
Or sitting is the new smoking, sorry. And I agree with that to a certain extent, but as far as preventive, the goal we have is that we see a lot of patients that I'd say at least 50+% of our patients that we see in this office, they're not in any pain at all.
Okay.
So they're coming to me, we're identifying those subluxations before they become problematic. So we can stop a problem before it starts, just like your dentist would by saying, hey, you got a little bit of a cavity here, let's put a little filling in it before it becomes full-blown dental decay.
Right, exactly.
Sorry, I went off on a tangent there. I hope that answers your question.
Yeah, no, that is great. That is exactly what I think that people, a lot of the mindset of you just go to the chiropractor when you're hurt, but it's actually a preventative aspect of health.
Right.
So, and like you said, it's not only to do with your back, it has to do with like you're having acid reflux, you're having all this. It's like everything to do with your nervous system. So that is extremely important. So there are there is one side of like the healthcare field that would maybe have like misconceptions of what chiropractors do. So can you give us like your kind of thoughts on that? What are some misconceptions that you hear about chiropractors?
Right. I've heard them all. And usually education is the best way to manage and to deal with people's expectations in general. So usually when I see new patients, especially, I ask them, have they been to a chiropractor before? What do they know? And then I go through a little spiel explaining kind of what I did with you right there. But I ask them, is there anything that we need to clear up? Do you have any questions you want to ask me before we get started? Is there any misconceptions? And some of them will say those things. Like they'll say, oh, I heard chiropractors hurt people. Well, statistics don't lie. If you look at our malpractice insurance, we pay less malpractice insurance than any other type of doctor imaginable out there.
Yeah.
And the reason for that, insurance agents aren't just nice guys. They look at statistics. They look at who hurt what, and that's why we are so cheap. So we talk about that and why it's safe. And there's many protocols. Obviously, trained chiropractic is very safe. We don't hurt people. If we did, we'd pay a lot, higher insurance deductibles. So that's one misperception that we hurt people. Now, granted, just like a massage to trigger points, you may be a little bit uncomfortable. Or let's say you've had joints in your spine that haven't moved in 20 years, and we start to move them, break that rust free. You may be a little bit sore for the next couple of days. So we always tell them that is a possibility. But I would say 70% of patients that come to see a chiropractor for the first time, at least in my experience, they feel better, even after their first adjustment, which is a hard thing to do. But other misconceptions is, chiropractors are quacks. And maybe the same could be true about other doctors. So to take it back again, chiropractic back in the day, osteopathic doctors were very similar. We both did manipulations. We both focused on the nervous system as the main cause of stress to the body. Osteopaths diverted more to encompassing different medical practices, and their philosophies were different. So they branched off with medicine. That's why osteopathic doctors are under the umbrella of the medical umbrella. Whereas philosophically, chiropractic truly believed in your body's innate ability to heal.
To heal
and
itself.
Innate intelligence is like the intelligence that everybody has in our body because we're alive and we're breathing and we have a spine.
Yeah.
That can't be explained necessarily by science, but it's what makes our heart beat, what makes our nerves transmit. So that's what chiropractors believe fundamentally. And we believe that you could obtain this great optimal health by removing nerve interference. Of course, you got to do other things right. You can't just get adjusted and go eat 40 Big Macs.
Exactly.
You got to have, a balance in your body when it comes to even your mental health, your physical health. You can't be 400 pounds, expect not to have any pain or inflammation. You got to eat the right things. So that's how chiropractic encompasses all those things. And doctors and people will say quacks, and maybe some people have had bad experience with chiropractors. And to that, I say, try a different chiropractor, because just like bad nurses, bad doctors, bad chiropractors, there's good ones. So you're going to get that experience. Maybe they rubbed you the wrong way. Maybe they didn't explain things. But the reason I think too, there's a big shift in the dynamic of even public perception, but even medical perception. So studies show time and time again that for musculoskeletal injuries like a strain, sprain, back pain, neck pain, cervicalgia, lumbalgia, disc-related injuries, chiropractic not only works better than medical treatment and even physical therapy treatment, but it's also way more cost effective. And they've done those recent as 2014, 2018. They've done these studies time and time again. Now, convincing your medical doctor to send you to a chiropractor versus physical therapy, probably not going to happen. But I also think physical therapy is more under the umbrella traditionally of the medical system. So when you have a neurosurgeon or even osteopathic doctor or a ortho surgeon, I mean, they're going to refer to the hospital and the PT that they have there.
Right.
So that's a misconception. The other misconception is chiropractors aren't real doctors. And the bottom line is, we have a slideshow here that we try and educate people with all the time. And when you look at the hours of post-secondary education where you're at a doctorate level schooling, whether it be pre-med, which our prerequisites to become a chiropractor are very similar to medical prerequisites. The actual schooling hours are very similar to become a medical doctor versus a chiropractor. Obviously, we differ in different classes. Like medical doctors will take a whole bunch more toxicology, pharmacology, how the body interacts with drugs. We don't do it. They even study more pathology. We study more anatomy and what the body and the nervous system is supposed to look like when it's functioning healthy, whereas medical, they spend a lot of time looking at sick care and pathologies and conditions that cause disease, and then they figure out solutions to those problems. So, but as far as, not real doctors, we're real doctors, we're just not medical doctors.
Right.
And that, I think, needs to be said, because we're not medical doctors, and we don't claim to be. We don't want to be. And I could have been a medical doctor. I chose not to be. And there's reasons for it. In my childhood, I was fortunate enough to have a best friend of mine who lived just a couple doors down, and his dad was a chiropractor. And I'd see people walk in there hunched over in obvious pain, and I'd be playing basketball with my buddy, and they'd come out like feeling good. And to me, I was like, this guy did this with, how did he do this? With his bare hands, he did this. And it's like, chiropractic literally means done by hand, without drugs, without, long-term stuff. And that's what really drew me to chiropractic. Do you have any misperceptions or things that you've heard about chiropractic that? No,
not really.
There's dozens of them.
Yeah. I think the mindset and the outlook of really society overall is shifting. It's shifting from a disease management to different aspects of the body can heal. What do I need to do to put into my body to let it heal? What do I need to do physically to let it heal? Instead of the disease management model of like what you touched on of, okay, you have this disease, it's already developed. How are we going to treat that? So I really feel like really just the mindset and science has helped that. Education has helped has really helped. And then just overall, everyone really kind of having more aspects of control of their own health. I think even with certain generations, you see it has changed, but especially like in our generation, we want to have control of our health.
Yeah, and you should. The only person that's going to make you healthy is you. There's not one other person. I have this conversation every day. It's like, but one, you want to be healthy, stop doing this. Everyone can be healthy.
Yeah, so, yeah, and like that's right. Like but if you would go back maybe a few generations, it was more like, well, my doctor doesn't necessarily think I need that, or maybe my doctor thinks I should take that.
Right.
But in which, I also have a hard time getting patients to take certain medicines that I encourage them to take. And so it's all about, let's look at the risks, let's look at the benefits, let's talk about where your quality of life is, all that.
I agree.
Because there is a place, obviously, we all know, for medicine.
Yeah, for sure.
There's also a place for chiropractors. Yep. There's a place for a whole realm of things. And the fact that I really see society moving towards a preventative aspect of health is encouraging for me.
I hope so too. And medical people are getting better. And in all fairness, medical doctors are fantastic.
Yeah.
I get referrals for people all the time, especially stuff that's directly in my wheelhouse, like headaches, cervical genic headaches. It's such a silly thing, but people get cervical genic headache all the time, tension tight headaches. It's something that usually we can help out with so quickly. They decrease their need for drugs, and there's just so many things. And even I feel like people could definitely do a better job of doing, like you said, benefits, risks, and alternatives. And chiropractic in large part is considered alternative medicine.
Yeah.
But I wish we could almost go back to a philosophy of almost like Eastern medicine, like Chinese, Japanese medicine, where their facets of health, they'll do 16 things before they go to drugs.
Yeah.
They'll do acupuncture, nutritional changes. They'll do yoga. They'll do Tai Chi, stuff that's known to reduce stress in their bodies before they need the drugs. So by the time your body needs drugs, you're already kind of at an emergency state. And don't get me wrong, I'm not against drugs by any means. I mean, there are certain drugs that I find and think that are overprescribed and possibly maybe cause more harm than good. But I'm not against drugs by any means. But when people come in here and they'll say, oh, I'm on 40 different drugs, the typical cholesterol, hypertension, and I have a little question there, how is your health? And they say, oh, I'm perfectly healthy. I have news for you. If you're on 40 different drugs, you're not healthy. You're trying to put out the fire. Like you're already damaged. And that's where the whole preventive health comes in.
Right.
Have the discussion. Hey, doc, I don't want to go on cholesterol meds. I don't want to go on hypertension. What should I do? Well, start off, let's lose some weight. Let's stop eating things that we know are notoriously bad for you.
Yeah.
Let's exercise a little bit more. Let's drink more water and do all those things. And then if you still need drugs because the risks of not doing the drugs outweigh the risk of doing the drugs, then go on the drugs. You know what I mean?
Right.
So.
Right. And like that's what I work with, like with a lot of patients, especially whenever I was primarily in primary care of, okay, so you have this, diagnosis, and I have to put you on a medication because if I don't, we're at risk. You're at risk for your life and like mortality. But as I put you on this medication, I want you to do this, and this, because we want to change your mindset. We want to change your lifestyle. We want to change everything. Because I don't want to just push you on the medicine. And that's one thing where the disease management model has, we're not helping people.
You're reactive
If
not
we're
proactive.
just giving you the medicine
Right.
over and over and over again. And that's to say some diseases, some diagnoses, you have to have a medicine.
Right.
Sometimes you can't even function
Right.
if you don't have medication. But there's a large amount, they say 90% of Americans, we have like some type of a metabolic issue
Right.
because of our foods.
Right.
So like 90% of Americans, we're at high risk for all these, hyperlipidemia, hypothyroid issues, all these things. And all of that does play huge into like what we're talking about of the preventative health, of what are the other sides of the healthcare industry that can help, besides just taking a prescription.
Right. Yeah. And that, it's funny, sorry to interrupt, but I just watched something the other day. Our president had a press conference. He said, out of 40 countries, we spend more on education than any other country, and we have the worst scores out of 40 countries.
Yeah.
It may not be a surprise to you, but it is very similar for health. We spend more per capita, and I'm talking more than probably 80% of the countries combined on healthcare.
Yeah.
And we are almost dead bottom in certain aspects of health, like infant mortality, different aspects. So something's wrong there. And this is why having discussions like this at least open up a dialogue to say, maybe there's a better way.
Right.
And a lot of it, and different chiropractors I look up to, they've said things like, the best way to prevent or to prevent cancer or to treat cancer is don't get it in the first place. It sounds boggling because we've lived in a world where we're at the mercy of our genes. We think it's bad genes, bad germs, and bad luck that cause all the problems. Our genes haven't changed in 10,000 years. It's not our bad genes. Something's happening in our environment that is causing the expression of epigenomes that is causing us to manifest more probability of getting type 2 diabetes or hypertension. In fact, the top 2-3 killers in the world are things that are, for the most part, 100% preventable. Strokes, heart disease, things like that. And it all starts with just educating. And I'm hopeful that, like you said, more and more people are taking ownership of their health.
Right.
They know it's not good to drink beer every night. They know it's not good to eat these polyunsaturated fats, these bad seed oils like vegetable oils and stuff. They know it's not good for you.
Yeah.
They know some of these food preservatives and dyes, even the stuff you use to put in your hair and your body, are known endocrine disruptors.
Yes, exactly.
The male testosterone level has gone down, like, I think the average was 40 years ago around 400. It's dropped down to like average at 200. Like, why is that happening? Like, why has testosterone levels gone from here to here in 40 years?
It's a metabolic issue.
Something's wrong. It's a metabolic issue. And even like at the base roots of health, and a lot of people will agree with this, that ultimately it comes down to a metabolic issue, and it stems from high insulin sensitivity, high glucose levels, which in turn increase insulin, which causes inflammation in our body, which then is at the forefront of causing any and all of these autoimmune type diseases and everything else. So that's the real basic. And I think people are more aware of that. Like, I could tell you 101 studies on different, like, too much carbs reduces your immune system function. Yeah. And even going back to chiropractic, there's tons of studies that show, like, with, for example, sports and chiropractic, there's been studies that show when you get adjusted, your muscle efficiency of producing ATP energy is more efficient at a muscular level for these marathon runners. There was another study that they did amongst people that got regular chiropractic adjustments compared to people that just got short-term adjustments to the spine, releasing the tension in the nervous system, that people that had long-term chiropractic care over years, and then people that had none, actually had higher levels of serum thiols, which is a measure of basically antioxidant health in our body, that is a good measurement of your physiological age. So you might be 40 years old, but you have the age inside physiologically of a 70-year-old if you're really unhealthy. Or you might be 40 and be like a 30-year-old. Yeah. And there's studies, countless studies like that have been done. So, taking chiropractic, taking nutrition, taking the stuff that we need to do to be healthier, obviously it's it's based on that person. That person has to take responsibility because, like I tell patients, there's no one in the world that's going to do that for you. But
Exactly.
I do believe, and I agree with you that, yeah, there is a shift. And I think even in medical schools now, they teach a lot more about general well-being and health, opposed to you got symptom A, you got disease A, here's drug A, B, C.
Yeah.
Even like I know patients will say to me, it's like, oh, my doctor says it doesn't matter what I eat. I usually tell my patients, and this may be harsh, you should probably find a different doctor because it 100% matters what you eat. These cancer doctors, even oncologists, they're saying, oh, it doesn't matter what you eat whatever you want.
Right.
Well, if you eat sugar, your immune system is going to be suppressed. It's going to destroy your gut, which 70% of your immune system stems from. No, don't eat whatever you want.
Right.
You know, there's diets specifically for cancer patients that have been proven effective, and they usually are low carb, high good fats, and stuff like that. So I do believe that, like, people that have graduated in the last 20 years, they get a little bit more of that in medical school. It's not just
Disease
do this, do
management.
this. You got this, take this. We need to do this. And unfortunately, some medical approaches, I wouldn't say do more harm than good. I mean, as a doctor, we all take an oath to
Help.
do no harm.
Exactly.
Right? And, you know, there's things that I know that general public don't know. And not to pick on osteopathic or ortho doctors, but I know that if you get a shot in your shoulder, your knee, or your hip, and you continue to get shots in your knee, usually corticosteroid shots, they give you relief for the first couple times. But eventually that shot
They don't work anymore.
makes friction. It dries the joint out. You are destined, guaranteed to get a joint replacement within years of getting those shots. So is that the end plan? Is the goal to get a joint surgery? Obviously not. And there's a time and a place, 100%, where knees especially wear out. They need joint replacements. And thank God we have doctors that do that. Same
Right.
thing with shoulders.
Yeah.
But it's like, if they knew there was an alternative to treat their back pain or disc pain, specifically to their spine, maybe
Before
they
they
choose that
started.
before.
Yeah.
And there are times, even for back surgeries, where there's a legitimate reason for back surgeries. Some people have such large herniations that through decompression or adjustments, nothing's going to pull that disc off that nerve. And they need to go in there and clean that out. There's times where you have instability in the spine where they do need to fuse that, because we talked about unstable joints. Well, that's a problem I can't fix. You know, so there's obviously a time and place for surgery. And I tell my patients, it should be the last thing, though.
Yeah.
Like, let's try this, this, and this, which I'm sure you do with your patients. Like, we don't want to do this, this, and this. Let's try this first, and then see. Then we progressively move to steps.
Right.
And it comes, sorry if I'm talking too much, but it's the same thing with the nerves in the body. Someone comes in and says, Doc, man, I don't know what's going on, but I got indigestion horrible. Well, the first step isn't going to be, let's do a barium swallow, let's do this, let's do that, let's put you on drugs, medication, let's do a stomach surgery, let's see if you have a hiatal hernia. Let's first check the T6 nerve in your spine and 7 closely correlate with the function. All the nerve messages going to your stomach and coming from your stomach. So the brain processes that and does what it needs to do for the stomach. Let's check the nerve going to that stomach first. And if there's a problem with that, let's fix that. And then see if you still need drugs, medication, surgery first. But people don't know that. And like I said, mostly people that get benefits from, for example, we see kids with, main thing we see kids for is ear infections. But we see colic babies, failure to thrive babies. We see
Do you see constipation in babies?
constipation all the time. That's
Yeah.
probably number 2.
Yeah.
Huge sacral parasympathetic distribution in the lower back. We release the pressure. The constipation 9 times out of 10 goes away with 1 or 2 adjustments. The
Yeah.
great thing about adjusting kids is that they haven't had the problem for a long time. You know, whereas you're 40, 50, 60 years old, you might have had that problem for 30, 40 years.
Yeah.
So, but
Yeah. No, that's really good stuff. So whenever you said for the community, like the majority of people that kind of brings them through the door the first time, a lot of times is pain.
yeah.
But they benefit from different things that's going on, like you've mentioned, like with acid reflux. You said that you get a lot of referrals for headaches. What is that primarily, like in this community specifically? What is something that you see frequently that you feel like the community could be aware of, like if they changed something or did something, or what would that be?
Right. If you look up chiropractic research in certain conditions, it's astounding how much research is there to help with vast numbers of conditions that people would otherwise think, I didn't know a chiropractor could do that. But most people know headaches, back pain, neck pain, stuff like that. Chiropractors vary in what they do and how they treat patients. Some chiropractors stick to subluxation-based care, and others get out into the realm of real physical therapy. They'll spend hours with patients really deep diving and ultimately trying to get to the source of the cause of the problem.
Yeah.
So there's conditions like, for example, we see a lot of patients who have adhesive capsulitis, frozen shoulder syndrome. Virtually, there's not a good treatment for it. It's considered an autoimmune disorder, idiopathic. They don't know what causes it. That the connective tissue basically attacks itself.
But we see that in diabetics.
See it in diabetics. So and diabetics are going to be that unique group of people that they naturally just don't heal as good. Their bodies aren't going to function. That's why they get ulcers. That's why they need amputations. It's because their body's already not working in a metabolic stress or syndrome where they just don't heal as well as they should. So I always tell people, even patients that are in bad shape, I say, we're not going to cure this or this or this, but we're definitely going to make your body work better. So with patients like adhesive capsulitis, personally, I practice the way I would want to be treated as a patient myself. So I do things that I would like. Some chiropractors, they do such low force techniques that people leave and they don't feel like they got anything out of it. So I practice in a way that, like, I know something happened. Like, wow, I can turn my neck good. Wow, my back, I just stood up and I don't have pain in my leg or my back.
Nice.
So I've, over the years, implemented certain physical therapy modalities that are outside of some chiropractic practice that include things like shockwave therapy. Shockwave therapy is one of the best treatments. And in fact, I don't think anybody in town has a shockwave therapy treatment other than myself. But what it does, it pulses ultrasonic waves to break up fibrotic adhesions, which is what causes frozen shoulder syndrome. But it's also very good for things like tendonitis, bursitis, fasciitis. So we get people with tennis elbow or little leaguer elbow, or even strains to the quads, whatever, the fascia. It helps to do that. And, before I had the shockwave machine, I could do different techniques. One really prevalent one is a technique I do called ART, which is active release technique. And what active release technique is it's actually where we strip away muscles to break up those fibrotic adhesions to get the blood flowing in there. And the guy that invented it was an Olympian coach. And what he did is he found that he could recover people from common rotator cuff strains, being Olympic swimmers, in about a quarter of the time that they otherwise would take to heal by doing this technique. And shockwave basically does that in a much quicker time.
Yeah.
And then we've introduced things like laser therapy, which helps with pain management, but also helps heal faster. So low-level light therapy, if you're not familiar, it works at a cellular level to penetrate tissues through the epidermal dermal layers, and it actually manifests by affecting cytochrome C oxidase in the mitochondria cells itself, and it actually makes more energy for the cell so it can heal faster.
Yeah, and your body has the capability
to do
a
it,
lot of the time. Yeah, isn't that
just
amazing?
use your body to naturally heal itself. And as chiropractors, obviously we do not prescribe drugs. That's not in our scope of practice. And I think nor would we want to necessarily. Now, there's a time and a place where we have patients' backs that are stoved up, they're hunched over, they've got so much inflammation that we absolutely, hey, you should go see your doctor and get some anti-inflammatories or whatever. There's certainly a time and a place, but yeah.
So you are obviously very passionate about preventative health, overall health. You're passionate about chiropractic care. You and your family, you live here in Olney. You're passionate about the community. You do something with the college, right? You teach a little bit. So, and you guys, your wife also does care here in this office certain days through the week?
Since COVID, when she had to go home and teach her children, she's kind of been on a little bit of a retirement. She's a fully licensed chiropractor in the state of Illinois. She can definitely come and do the things she does, but she doesn't. She does do a little bit of acupuncture from time to time. She's certified in acupuncture, and that helps.
I didn't know you guys had that. You were able to do that?
So lately, what we've been doing since we've had that shockwave, she does a lot of dry needling, stuff like that. The shockwave works just as good as the dry needling and probably faster. So we've been doing that as an alternate. But yeah, she will and does come in. She helps me out more with billing. And like I said, for lifestyle wise, when we moved here, it was more of a decision for her to be able to stay home, help out with our family, be with our family more.
Yeah,
and that's the main thing. And it's great. It works out that we're able to do that, and I'm happy and to do that. And but yeah, she can definitely do all those things, and she helps out where she needs to. But for the most part, it's me. I would love one day to integrate a practice to where we could get a physical therapist in here and have the best of both worlds, because physical therapists don't do what we do. They don't adjust the spine, or at least they shouldn't be adjusting the spine. And that's a whole different ballgame when you can do that and release muscle tension by releasing nerve tension. I adjust people's knees all the time. And I'll feel in the back of their knee, and they're like, oh, that hurts in the back of the knee. And that gastroc, that soleus muscle is very, very tight. And sometimes that knee subluxates this way or this way. And even, believe it or not, knee replacements can do that as well.
Yeah.
So when I adjust that knee, immediately I push back on the spot where that muscle was really tight as a guarding mechanism, and it's gone, and their knee feels better. So when joints are out of alignment, it by default tensions up the muscles associated with that joint. And by relaxing those joints, you can go get a shot, you can work it out with your muscles, or you can adjust the joint and the muscles relax. So
yeah, no, that's good. It's like full spectrum, everything. Right. So awesome. Well, we are going to wind down here, and if you could just give like one piece of advice or anything like that for our community, for their health, what would that be?
That's a big question, but in general, like we had said before, you're the only one that's going to be responsible for your health. No one's going to do it for you. No one's going to care if you get diabetes. No one's going to care if you're overweight. You have to take responsibility for yourself and really your children. So it all starts by doing the things that we know to be helpful and healthy. Things like we talked about eating healthy. And there's so many resources now that we know what healthy eating is and what it is not. Like obviously, if you just avoided processed foods, you'd be healthy. Huge. I have a patient who, 80 years old, went to the Philippines and started eating non-processed foods, got off all his medications, living his best life. And It's crazy that other countries, like we consider third world countries, Philippines, India, they actually eat less processed foods and actually are a little bit healthier than Americans. Yeah. So that's a big part of it. Less sugar. Obviously, we want to remove toxins from our body, and that's avoiding toxins. Things like drugs, alcohol, that street stuff, even just toxic foods that we have. And fortunately, it looks like we're going to have some changes that we're going to start getting some of these bad dyes and things out of our food, which why wouldn't we want that?
I know.
Then, of course, neurologically speaking, we want to make sure the spine doesn't have nerve interference. So if you've never been adjusted, it is definitely worth it to come in and get your spine checked, just like you get your teeth checked. And we can find problems before they become bigger problems, because subluxation and arthritis is on a spectrum, on a scale where you have none perfectly healthy to severe fused. And all that in between is where you should be getting that care. We can keep people from going to the fusion spectrum of arthritis. We're talking osteoarthritis, not different types of inflammatory arthritides, but we can keep them from progressively degenerating by restoring mobility to joints. So when joints don't move, they progressively degenerate. Whereas if we can keep those joints moving, you should never get arthritis.
Right. So like really, really what I'm hearing you say is like, you've got to be intentional on your health, not for yourself, for your family. You need to be preventative. Yes. You need to do those things. You need to possibly get checked, every once in a while if you're not having any pain, but you set up like treatment plans for that. And then another huge thing also, whenever we talked about like the mindset, is insurances. A lot of insurances pay for chiropractic care now, right?
True and true. The only issue is that, and I think you would experience this as well in your billing and your practice. Insurances kind of suck nowadays. The deductibles are getting way higher. I know people notice an increase in their car insurance, homeowners insurance. So yes, most insurances will 100% have chiropractic coverage, but the problem we run into a lot, just like you would, is that people are getting $5,000, $10,000 deductibles. But believe it or not, Medicare has chiropractic coverage.
Really?
And if you have a secondary,
Nice.
they will cover your care at virtually 100% if they cover your deductibles and copays. And even if you don't have a secondary insurance, it's usually about 20% of our charge, which is around $8 to get adjusted. So the geriatric population in general could benefit immensely, quality of life wise.
For sure.
They're keeping them up. And I say so many things to patients on a regular basis. I say things like, you got to move it or lose it. Historically, people that are the best, they live the longest, they have the best quality of life, least health problems, least amount of drugs, are the people that just get off their butt, they move, they walk every day. Americans in general, we're talking 5,000 steps, sedentary lifestyles, and that causes problems in and of itself.
Right.
So get up, move, be active. We see a lot of athletes, and they love chiropractic care. Why? Because they're going to function at their top of their game. But I treat a lot of OCC baseball players, notorious shoulder problems, a lot of pitchers. But being proactive and not waiting until it completely goes out is a lot better than waiting until they're sick and then, now we need surgery.
Exactly.
So.
Well, I have learned so much today, and I really appreciate it. I appreciate what you're doing for people's health, for the community. That's why I'm interviewing people like you, people that are doing things maybe a little bit against the grain that benefit the overall health of our community, and because that's why we're here, right?
Yeah.
So it's been awesome, and so I'm excited for what the future holds for our community and what we can help them achieve with their health. So
it's awesome, and thank you so much for having me on. It's a pleasure. It's always nice to be able to share with people because, like I said, such a small percentage of the population hear this stuff.
Yeah, exactly.
So thank you. I appreciate it so much, and anytime you want to do it again, we can talk for hours about this stuff.
All right.
So thank you so
Thank
much,
you.
Marissa. Appreciate it.